Faith-based health providers are calling on the government to urgently release more than 10 billion shillings owed to them by the defunct NHIF and SHA, warning that delays are pushing some facilities to the brink of collapse. The consortium of faith-based organizations, which claims to provide health services to an estimated 40% of Kenyans, is also demanding inclusion in the newly inked government-to-government health deal between Kenya and the US. And as Mary Muoki reports, their appeal comes amid shrinking donor funding and growing pressure on health facilities that have long filled critical gaps in Kenya's public health system.
For decades, faith-based organizations have been a backbone of Kenya's health sector, running hospitals, clinics and supply chains in some of the country's most underserved areas. But the consortium now says that the model is under threat owing to NHIF SHA debts. The consortium warned that delayed reimbursements from the Social Health Authority, including debts from the defunct NHIF, are crippling operations.
The care providers are not happy because billions of shillings for the services that have been rendered have not been disbursed to the facilities. And as leaders in the health sector, we continue asking the government, the treasury, to make it a consideration.
The organizations are also pushing for a seat at the table in the new government-to-government health partnership between Kenya and the United States, arguing that excluding them would leave out a significant portion of service delivery.
We request you to deepen your investment in the faith-based organizations. We have been there when things are working, and we have been there when things are not working.
We have now to have the funding based on the projects we have been implementing, which were funded by PEFA and CNDC and USAID and also DOD. It means that now, as FBO, we have to engage government to government.
The General Secretary of the consortium, Dr. Chris Barasa, says the organization is ready to partner with the government and willing to lend their technical expertise to the government, while adding that collaboration is the solution as Kenya pushes towards universal health coverage.
To be present and available as and whenever we are called upon. And we are ready to collaborate with the county governments. We are also ready to collaborate with national government. We are also ready to collaborate with global governments, with global entities, to be able to ensure that Kenya achieves universal health coverage. That's when we either get funding from out of the country, from global donors, individual donors, or even foundations or governments, or we do what we call domestic resource mobilization.
Mary Muoki, Citizen TV.